Welcome to another episode of Grad Chat from PhD Balance, where we talk about topics of grad school beyond the academic research and that may be more difficult to talk about in our day-to-day. I'm your host, Fay Lin, and I'm a PhD candidate in biochemistry at UCLA. If you like what you see here, check out the PhD Balance YouTube channel for more grad chats, and don't forget to like and subscribe below. Our topic today is establishing mental health literacy in academia, and I am so excited to talk to our guest, Dr. Wendy Marie Ingram. Wendy did her PhD at UC Berkeley in molecular and cell biology and her postdoc at Johns Hopkins School of Public Health in psychiatric epidemiology. Her research focuses on understanding psychiatric illness from molecules to populations. Wendy also founded a nonprofit called Dragonfly Mental Health. They are a volunteer-driven global consortium that develops, deploys, and researches evidence-based approaches to improve mental health among academics. So welcome, Wendy. It's great to have you.
It's so good to be here, Faye. Thank you so much.
So our topic today, again, is establishing mental health literacy in academia. And to start, do you want to describe a little bit about what is mental health literacy? How would you define mental health literacy?
Yeah, sure. So mental health literacy is like health literacy, is like not reading and writing just words on a page literacy like you would normally think about, but can regarding mental health. Does someone have familiarity? Do they have the basics to read about and understand and take in new information about and integrate that with their understanding of mental health, their own mental health in general. And so mental health literacy really is a focus on, if you mention depression, do people know what that means, like really means? When you mention OCD or obsessive compulsive disorder, do they immediately just think to the representation of that on TV, where it's often misconstrued or kind of caricaturized, or does the person that you're talking to have true mental health literacy, where they understand that there are biological, there are environmental factors that play a role, that it involves the brain when you're talking about mental health, as well as everything along the mental health spectrum, from health to disease to crisis. So that's what we mean by mental health. Does that make sense to you, or do you have other kind of questions that brings up?
I think that's a great definition. And you brought up so many great points about just maybe a lot of how we see mental health is influenced by stigma or stereotypes or what the media portrays as mental health, which may not always be true. So, for example, I know we've talked about depression doesn't always look like falling asleep in bed and can't getting up. There's high functioning depression. There's a really wide range of images that can arise from someone who is depressed, right? And really bring literacy to challenge those stereotypes and images is really powerful. And I think one of the key things to mental health advocacy these days is challenging stigma and stereotypes.
Yeah, absolutely. And that's where mental health literacy is one of the founding blocks upon which we can achieve those goals, where we fight stigma because we displace myths with information. We use whatever knowledge someone kind of comes in with, and in order to get them to better understand in a more accurate way what we're talking about, what we mean by depression versus burnout versus psychosis. Like what does that mean? And all of those things are influenced by a variety of factors that change over time. It depends on what you were exposed to as a youth. Did your family ever talk about mental health, or did any mental health struggles that might have been happening in the world, in your family? If you saw someone who was muttering to themselves on the street, did your mom or dad, explain explain what schizophrenia is and what this person might be struggling with in a compassionate way? Or did they just jerk you away and say, don't ever talk to people like that? So those kinds of early phases of your exposure, of your training, builds into your underlying self-stigma or beliefs about people who might be struggling with various things. One of the comparisons I make is, we're kind of with mental health. And one other point is how much we actually know as a community, as a research community, as a scientific and medical community about these illnesses. So those two things kind of relate to mental health literacy around, or health literacy around cancer. 50, 75 years ago was much, much lower. There was tons of stigma around cancer because we didn't know that much about it. And people didn't know how to explain it to each other or to their children. We didn't know about screening and catching things early and that it can be treatable. We didn't know how to treat it very well. So mental health is, kind of entering into the phase where we can treat it, we can detect it, we can help prevent mental health struggles, but we still have a lot of stigma, we still have a lot of low mental health literacy amongst the general population and also even among academics. And so this is something that we'd like to get up to speed, so to speak.
Yeah, I think this idea of mental health literacy is so important, and it's so important to have a definition for it because people often don't realize that we talked about these portrayals in the media or all of these other aspects of stigma that you mentioned, that those essentially are indicative of maybe poor mental health literacy, and people are just not as informed as they can be about what it means to struggle with mental health. Let's see, Alex in the chat asks, what is the best way to gently correct folks when they say things like, quote, the weather is so bipolar today, or I love color coordinating, I'm so OCD? And I think this is a great question where it's also indicative of maybe poor mental health literacy, where people don't realize the meaning of bipolar, or the meaning of OCD, and how that can be potentially a hurtful way to phrase a question. So do you have any thoughts on that, Wendy?
Such a great point, Alex, and really important to figure out how to bring it up rather than just let it go if you feel comfortable and safe doing so. So if it's someone that you know really well, maybe this is an entry point to having a little bit deeper conversation with them and improving their mental health literacy. Sometimes that can start with a question. One of the kind of personal mantras I have to help with all manner of things is be curious, not furious. So when somebody says something, maybe they don't know, maybe they don't have an idea of the fact that, the weather is bipolar can be a hurtful statement, and it's something that can further stigmatize someone and shut people down if they do happen to have that illness. I do have bipolar disorder. And so and I know that also schizophrenia is really regularly misused as well, and often used in a very derogatory term, but there are lots of amazing, wonderful people. Like, schizophrenia is a disease of the brain, just like any other disease of an organ. And it's something that a lot of people can live really wonderful, lovely lives with. And so perpetuating those kinds of misunderstandings and using it as a derogatory or self-deprecating, like, my brain's all over the place, I'm so schizophrenic today. You're giving yourself a negative comment by using a disease. Like, that really is kind of harsh. So maybe some tactics for that could be to question, as compassionately as you can, usually works better, do you know what bipolar disorder is? Do you, question their knowledge on the term that they used? And maybe that can open a conversation. If it's not a situation where you can kind of maybe help turn it into a learning moment, maybe approaching it with, bipolar disorder is a disease. It's kind of rude to use that terminology, or something like that, and the so those would be kind of like my initial approaches, but saying something and trying to turn it into a conversation and a learning moment is probably going to be the best approach, as opposed to assuming their malintent and making it or helping make it into more of a combative interaction.
Yeah, I think that's so important. I think communication is so important when we talk about mental health and there's so much stigma. Just having open dialogue and really emphasizing the communication that, hey, this way you said the sentence didn't really resonate well with me, or like asking, hey, by the way, bipolar means, a specific mental health disorder, and just taking the time to have that conversation, I think can go a long way, especially when I think a big problem is that we don't have enough of these discussions, and just starting out tackling it straightforward. And again, like you said, Wendy, in a not attacking way, if I were to capture what you were saying, well, is so important, and just having the tools to start those conversations, and one, just noting that something you said didn't resonate well, and here's why, is a great way to go. All right, so we had people submit questions on social media, and people are interested in, how did you get into mental health advocacy, and what was the moment when you decided to found Dragonfly Mental Health?
Thank you so much, everyone who asked questions. I honestly have been interested in mental health, mental illness, since I was very young, and did the, kind of had the interest in going into medicine, or psychiatric medicine, or neurology, or something along those lines initially when I first started undergrad, but really became disenchanted with how little we knew at the molecular level and at the personalized level, how to treat individuals. So at the same time, I started research in a biochemistry lab and studying molecules with circularly polarized light in a biochemistry lab was just like mind-opening. I loved it and fell in love with bench science. So I decided to go to get my PhD and study psychiatric illness, learn the skills to be able to better understand psychiatric illness from a molecular level. That's what ended up with me being not in med school, but instead in a very basic program, molecular and cell biology program at UC Berkeley, which was incredible. I absolutely loved it. And we had pretty big classes. My class was 56 people. The class behind me was 29. And what really got me started in mental health advocacy, especially specifically for academics, was during grad school. And so during grad school, my fourth year, one of my third year classmates died by suicide due to depression. And, we as a community were just devastated and didn't know what to do. And in fact, didn't find out in a very compassionate or in my opinion, appropriate way. The university and the department didn't have a plan in place for when something like this happens, because the student my friend had taken a leave of absence. And so they weren't technically a student at that moment in time. And therefore there wasn't technically a a method in place for how to communicate the loss of this person. And to us, we all found out through the grapevine, like running into people in the hall. And it was horrible. It was absolutely horrible. It was salt shoved into the wound of the loss of someone in the first place. And so that really was a trigger point for not just myself, a lot of other people in our program. And despite being kind of a very basic science, no medical, no pre-med type of people really in the program, no medical research going on. There was about 9 of us who ended up coming together and forming from my class, the 4th years in our class below us, that came together and just started coming up with like, what the heck can we do better for each other and for like when something like this happens. And that's really what kicked off my role and my activities in mental health advocacy for academics. And we did a bunch of things. We prioritized by our own kind of lived experience. And one of the things that became really glaringly obvious to us was that all of us were struggling and none of us were telling each other about it. There was this like code of silence or something. There was, it was probably driven a little bit by imposter syndrome. Like everyone was worried that we were the only ones struggling, that everyone else had their stuff together, but then we were all contributing to this false facade that, we've got everything together. And everyone saw our successes, our publications, our presentations, like how we were doing. We were all very busy and doing well in various ways, but we were not doing well. Most of us were not doing well. And a lot of us had been seeking professional care and had told no one. So the stigma that was around it was also really driven by not knowing, by lack of mental health literacy. And, we had 5 different divisions, one of which was neuroscience, and all of all of us, including the neuroscience people, were like, I don't really know what I'm experiencing and I don't know how to talk to other people about it. And I feel like it's a failing, not a normal biological response to the amount of pressure I'm under. And so that really got us started thinking about and kicked off both my advocacy work as well as a heavy dominance in we need to better understand, we need to improve mental health literacy amongst ourselves in order to be able to have these conversations.
Thanks for sharing your story, Wendy.
Thank you.
Keep going.
Yeah, so it didn't stop there. It kind of had always been on my mind a little bit after we started. It was called the MCB Grad Network. You can Google it if you want. It's still going to this day, which is really cool, because sustainability of these kinds of grassroots efforts isn't always guaranteed. So I'm very happy that continues to be a group by students for students, and they create events and programs and peer mentoring connections that are still helping people today. But after that, there was still this piece of what we did seemed to be helpful. How do we get others to do that too? Niggling in the back of my mind. And when I found myself in the Department of Mental Health studying psychiatric epidemiology at Johns Hopkins, I started getting a little more excited about getting the word out and encouraging others to do the same, and maybe, putting together something that others could use as a blueprint or whatever to then make their own version of it that would work for them. And around that time, I lost another friend and classmate, and so to suicide and depression. Dr. Chris Alvaro, who I mentioned a few times on the Instagram takeover yesterday. And so Chris Alvaro was one of the people who helped found the MCB Grad Network with me and our other friends and colleagues. And Chris struggled with mental illness, same as a lot of us, myself included. And it just, like, losing Chris was a hammer strike that that made me from, totally transitioned me from thinking of like, oh, we should get this out, this, show other people how to do this, that it's possible to improve mental health in your own community, and turned it into a serious passion of mine. That took up a lot of time. And so for the remainder of my time at Johns Hopkins, I worked with graduate students and other postdocs and trainees at the School of Public Health, both in that school at the department level as well as university-wide, to really just try to systematize and create evidence-based approaches to dealing and improving mental health among student populations, especially postgraduate students and above. And we did a ton of work with the Johns Hopkins School of Public Health Mental Health Grad Network. We created another grassroots efforts there. And then I started talking to media. And so I started talking to Science magazine writers and to Nature, and to folks that were interested in this. And someone in Europe ended up seeing my one of the articles about the work that I had been doing so far, and invited me to give a keynote talk at a conference in Berlin last September, the iScientist conference. And when I went there, I just designed my talk to encourage others, to make it known that there are ways to do this. You can do this too. You can create change. And what ended up happening was that dozens and dozens of participants, in fact, by the end of it, there were over 100 people interested in an idea to create a worldwide organization focused on academic mental health. And so that's really how Dragonfly Mental Health was born. And it was born from people coming together and talking about what was wrong and what, is wrong with the system. And and with our communication and with our coping strategies and with the advice that we've been given and the resources we've been given so far. And there was just this overwhelming call for the creation of a worldwide organization focused on all academic mental health. And so over the last year, I've been working closely with amazing, incredible volunteers to create Dragonfly Mental Health. So that's my full-time job now. I did not anticipate that.
Sounds like an amazing journey. And thanks so much for sharing so much of your personal story and maybe experiences of essentially tragedy that really jump-started, from what it sounds like, jump-started your advocacy. And I think, especially when it comes to topics of suicide, it's really difficult to get that open dialogue going. And I think
Sorry, I have a bug in my hair.
Ooh, live.
There's a very tiny caterpillar crawling around in my hair. Let me get that real quick.
Hello, caterpillar.
Come on. I want to squish you. How did you get in there? I was doing yard work earlier. Okay. Can you see that?
Can I see? Oh, that is a caterpillar. Well, he wants to join in on our grad chat because these are such important discussions. I just have to say.
He has something very important to say. I don't know where to put. I'll put him here. We'll see if I can get him outside later. Okay. All right. Carry on.
Back to mental. But I guess, so people have submitted a lot of questions here. And you talked a lot about the amazing stuff that Dragonfly has done. And I think one question people are interested in is, how does Dragonfly's offerings differ from on-campus psychological and counseling services?
They differ completely. because we provide no mental health clinical care or medical advice. So we're advised by psychiatrists, psychologists. One of our board members is the phenomenal Ray DiPaolo. He is the former chair of psychiatry at Johns Hopkins. He's the current president of the National Network of Depression Centers. So we work very closely with clinicians, but we very intentionally are not, providing personalized individual mental health care or medical advice to individuals. So that's a very clear distinction between what is mostly offered by psychological services at universities, through psychologists, through access to psychiatry, things like that. What Dragonfly focuses on are the things that really have more to do with changing the climate and the culture, creating real change in stigma, real change in the ability and adeptness with which to communicate with one another around these topics, to better understand what may be happening with yourself and others without it being, one-on-one personalized, let's talk about your medical history, your family history, blah, blah, blah. We don't do any of that. We 100% refer you to medical professionals for anything like that. We do support and facilitate peer support. So one of our offerings is, again, no medical advice, no medical care, but peer support from others who are in academia through something called Dragonfly Cafe. So we have 3 days a week, a live session of that anyone within academia, any level, graduate students, postdocs, faculty, staff even, are welcome to come to, because and it's safe to talk about mental health struggles and receive peer support, and not medical advice. And then the other thing that we do at Dragonfly that really, works off of my passions and my training is that we are conducting and gearing up to conduct research to build evidence on what is causing the problems, what's leading various people to have these struggles, and what can we do about it, and what are what are evidence-based approaches and interventions that can help change things and prevent things. And so we're gearing up to we study every single intervention and project and program that we create anytime we get a chance, with permission of the subjects, obviously. We also are hoping to work with, gearing up to work with the universities themselves, the healthcare providers, to anonymously, of course, de-identified data, better understand what's going on with the psychiatric needs and care of universities, and the students and faculty and staff that are there and receive care internally. So we're doing epidemiological research. We're doing treatment research, or not treatment research, sorry, intervention research. And we want to best understand, use the skills we have, that and the connections we have to be able to conduct medical informatics research, things like that. So yeah, I think those are the 3 domains: research, peer support, and then evidence-based programs directly to universities and campuses.
All right, so our next question here says, what has been your experience with trying to make change in mental health stigma in academia?
What the experience we've had is that the need, the call for it, the readiness for change is really quite alarmingly high. Reflecting the state that we're in academia right now. I think that people have been thirsting for the ability to have these conversations, to learn more, to be able to support each other and their colleagues in more with more confidence in what they're doing and how they're doing it, so that they don't cause harm. That they are being supportive. There's a lot of really amazing and incredible amounts of interest in adding mental health within academia to scientific programming. A lot of the talks, the initial talks and workshops and things that I've developed with others and conducted have been in the retreat settings, for example. So departmental retreats, they have all these scientific programs, and then right before lunch on the second day, I give a mental health literacy talk, and that just like stimulates this incredible amount of conversation in free time and in communication amongst this community to destigmatize, to better understand each other, and feel seen if they are the ones struggling, which many of us are. So my experience has been that there's a huge need out there, and there's a lot of relief, honestly, in having access to programs and talks that are going to make serious change, and not just kind of surface level encourage yoga and meditation, which I do both, and I love both, and they're very helpful to me personally, and I think they help a lot of people. But the only speaking about that, only producing those kinds of resources and discussions, isn't enough. It's not addressing the whole spectrum of mental health to crisis. And so that's where I think a lot of the interest has been, by having serious but well-informed conversations around that.
So Wendy, you mentioned so much about the positive aspects of jumping into mental health advocacy, and I just want to echo that sentiment, especially as someone who also advocates for mental health, and being a bit nervous about it in the beginning, about how it will be received because of societal stigma, and then seeing all this, the new people I met, and the positivity, the positive vibes, and how receptive people are to this stuff. It was really empowering, and I think eye-opening, that these discussions are so important to have. They lead to positive change, and that people want to talk about this stuff, and stigma really is a barrier preventing great people from connecting. So it has been, just want to echo how positive it has been on both of our accounts. I think another common question that people ask is, have you ever received backlash when advocating for mental health?
That is a great question. And I wouldn't say that I've experienced backlash, but I've definitely feared it, which has created some hesitation over the years, especially earlier on when I was a PhD student. We decided to create a by students for students organization of like peer support and talking about mental health and encouraging, help seeking and stuff among our peers. But even at that time, we thought that, engaging with faculty and encouraging faculty to get training and better communication skills and things like that would be beneficial. We didn't feel empowered to make those requests or make those demands. And so I think it was because of the fear of backlash. So I totally personally understand that question. And what, as I've continued on in my career as well as in my advocacy, I'm not sure that was warranted. So, so long as you go about things in a respectful and and compassionate manner, and not assume people's malice, but then, maybe we could have made change. Maybe they would have wanted to engage with us at that earlier time. But what I've never experienced backlash. What I have experienced is pushback, and kind of similarly, what's been interesting. So some things we've come up with and had priorities and had ideas, and then brought them to administrators or brought them to faculty chairs or people, people in power, and we have or certain committees or something like that, and have been told, no, you can't do that. We can't do that. We don't have money for that. You'll never get faculty to take mandatory training. Kind of an avalanche of no's around various things at various points. Not a ton, but definitely have hit pushback. And one of the things that, kind of I mentioned earlier, be curious, not furious, really has benefited us in being able to figure out what the barriers are and if they're real, and to come up with solutions to get around those barriers. And so what has been truly amazing has been being able to have those conversations with folks that may initially say, no, it's not possible, and determining, is it not possible because you can't get the funds to cover bringing in an external workshop or something, or you have scheduling trouble, or you have already overburdened the faculty with a bunch of different things, and they want to prioritize their time and protect faculty time for risk of burning them out. And so when you learn what's under the surface of the initial no, of the initial pushback, you can start ideating answers and solutions around those things, and get to a place where, maybe with some creativity, those things just drop away, or maybe persistence really is the answer to that as well. And so one of the things where we initially got some no's at Johns Hopkins, what we did was we actually engaged with some folks that were like in marketing and like kind of business communication, and they gave us some ideas. They were like, oh, you should bring with you takeaways, or leave behinds, I think was the term they used. And so we just came together and put together, our arguments, but very, succinctly, visually attractive, and then presented them to the dean. And we got invited to present our ideas for a faculty workshop to all of the heads of all the departments with her support. And we launched this whole program that previously people had said, no, we can't do faculty training. It's impossible. Blah, 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 blah. Another thing with the same example, just to stay on track with that, we initially got a number of no's around faculty training because it would take too long. You would need a half day or even a whole day training in order to cover all the critical things and blah, 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 blah. And while that may be true, to have a comprehensive training to prepare faculty to speak to their students and recognize issues and stuff like that, we as students and postdocs and a few other trainees of various sorts got together in a room and were like, let's see how long we can make it. Or how short we can make it. And we got together and we created our own curriculum of a 90-minute program, and then came back with this finished slide deck, or it was 98% done. And we were like, look, we can have a 90-minute one. Can we have 90 minutes? And they were like, oh yeah, you can definitely have 90 minutes. So it was time. So there's all these things that an initial no, an initial pushback may not, even if it does feel a little hostile at first, if you dig at it and you try to investigate what's underneath that, you can then maybe come up with really good solutions. So so that I haven't experienced backlash. I have feared it, maybe inappropriately so, and most pushback is dealable. You can engage with it. So and still get positive outcomes.
Yeah, I love how you told your story of how people were genuinely receptive once they had these initial maybe criticism isn't the right word, but reluctance to engage, and then you really a lot of it is just presenting the facts and saying, hey, this is important, this is how we're going to do it. And maybe part of it is also just laying it out for them clearly about why it's feasible and why it's important is a great way to get people engaged. I think a lot of the times people are reluctant, unfortunately reluctant to do the work because, I mean, it is a lot of work. Advocacy is a lot of very important work and energy. And sometimes it's the fact that people don't have the energy but once you present it in front of them, that really gives a good argument that it's important. And once you do some of the work for them, it makes it a little bit more attractive. I mean, at the same time, this should also be a push for, if you're not engaged, to get engaged and to get involved in the conversation, because this is really important stuff. So I hear a lot of great information here. One, if you are thinking about advocacy, laying out a concrete plan and having a conversation about what you're going to do, why it's important, seems very valuable. And two, also getting people engaged if they are reluctant to put in effort. Also encourage them to get involved, and that this is a cause for sure worth getting involved in.
Yeah, absolutely. And I'll follow up on your, kind of points that are so critical with maybe 3 other points of that I would recommend. So if you are interested in getting activated in this space or starting your own kind of advocacy work, one of the things that I would highly recommend is find community. Internal community within your, department or division or class or whatever level, or reach out to PhD Balance, reach out to Dragonfly, get in touch with us to find community around, to start talking about your ideas, what you're thinking about, how, and forming some ideas and strategies. The second is to, once you have that community and you brainstorm all the things that could be done, to prioritize, to pick one thing to move forward on and move forward on that. And then, you've got a whole list of things that can improve, but you always have to want to start somewhere. And so prioritizing community and then prioritization are 2 great steps. And then the third, I would say, reach out to others for ideas, for resources. So PhD Balance is an incredibly huge, wonderful community, leveraging that, communicating with them, getting more ideas or access to free resources or stuff like that would be really, really helpful. Dragonfly, we're working on that and building those resources as well. So for example, if you wanted to start a peer network within your group, we have a free webinar that we conducted a few weeks or maybe a month ago now. Time flies. But that is on our YouTube channel. Look up YouTube Dragonfly Mental Health. And we have a peer network, starting your own peer network, free webinar talking about that. We're going to also start up a online community for people starting their own peer networks to talk to and communicate with each other. So all of those things are, it doesn't have to fall all on your shoulders. Asking for help, getting other resources, finding other people and organizations that can help, take the burden off of your shoulders are the 3 things I would recommend.
Finding communities is so important. I think one of the biggest takeaways or biggest messages that can greatly help, if it's advocacy or just like these are tough topics to talk about, and finding communities and connecting with other people is just absolutely so rewarding, so helpful for my own mental health, and just so important to keep in mind. All right, we are running out of time for today's grad chat, but Wendy, if there's anything in addition that you want to bring up that we haven't talked about yet, or any concluding remarks that you want to give?
I just encourage folks who watch this and resonates with you to follow us on Twitter, Dragonfly MH, or on Instagram, Dragonfly_MH. or, come to our website, dragonflymentalhealth.com. And please feel free to, check out what we're putting out there for free resources, as well as you can get on our listserv if you like, and we'll let you know when those things are coming up. Join us at Dragonfly Cafe. It's 3 times a week. I'm often there, and the people there are just absolutely incredible. It's been such an amazing joy and unexpected benefit of the pandemic to get to know and really befriend incredible people involved in academia, and especially academic mental health, passionate about that. And from around the world. It's been cool. We've we've had everyone, people from 6 continents join us there. So it's really truly fantastic. And we, bring us to your campus if you like. Reach out to us through our website to do that. Request us. And I would say if you want to volunteer, we've got an incredible group of 130 volunteers from around the world. And there's, from as small little things as least frequently as you like and your schedule permits, to, we've got leadership roles available to push our working groups forward, and start new working groups depending on your passion. So there's a whole range of ways in which to get involved with us. So it was really great to be able to do this with you, Fay. Thank you so much to PhD Balance and to you for inviting me.
Yeah, this has been awesome. And I just want to second, go follow Dragonfly Mental Health, go to their website, check out the offerings. Again, they can come to your campus and offer some great mental health resources and workshops. So it was absolutely incredible to have you on, Wendy. So this has been Grad Chat from PhD Balance. We usually go live every Saturday, 12 p.m. Pacific, 3 p.m. Eastern. If you like what you saw today, subscribe to the PhD Balance YouTube channel for more notifications about Grad Chat. But until then, we will see you next time. Right,
Thanks so
bye.
much.